So whenever you are coming to this particular bone, we have three topics to cover over here. So first thing is you have to identify the bone. That's number one. Then you have to determine the side, which side it is. If it is, two of their side is there, right side, left side, likewise. Then the third thing, you have to hold it in anatomical position. Then it begins with the descriptions of the bone, and rest things will be followed. So these are three prerequisites for this bone anatomy. Without this, you cannot begin with. So you cannot perform any of these three, the exam never begins. So name of the bone, side of the bone, anatomical position. Then you just like to go on the proper exams. Without before that, if you stop before that, there is no exam actually, right? So this particular bone, we call them as the scapula. So this is a flat type of bone. You can see that this is a flat bone. If you look at this particular bone, this is a longer bone, and this is also long, but this is short. So this is short bone or short long bone, and this is curved. So curved, short, long bone. This is just long bone. This is a flat bone. So this particular bone is present on the back side of the rib cage, posterior side to the rib cage. Now whenever you are saying that, you have two backbone there, right side, left side. So you have to identify this, which side it belongs, right side or left side. That's the thing. So this particular bone can be identified by some anatomical facts. So you have to identify above, we have to identify below, you have to identify medial, you have to identify lateral. Then you can identify anterior, you can identify posterior, right? So these three things you have to identify first, above, below. So this part looks like map of India or African map. This is tapered down is inferior part. So this is bottom, this is above. So this is superior, this is inferior. Now this side and this side. So this back side have got projections. So we call them as bony projections. So we call them as process. So this side process has there. This side no process. So this is posterior side. So this is anterior side, this is posterior side. So above, below, anterior side, posterior side. So 4 ends covered. Then lateral and medial. So once you see this particular expanded circular or semicircular oval part is lateral side. The opposite side will be medial. So medial and lateral is identified by this. So above, below, anterior, posterior, medial, lateral. So this has to be 2 on the sides, right side, lateral side, left side. Now this side has to be placed on the lateral side. So if this one is a midline, that means you have the spines present in that. So if you place it like this, is this directed medially or laterally? Medially. And this side, if you place it, this side is present on medial, lateral. So this is laterally placed. So this one has to be placed laterally. So this is known as lateral angle, or this part we call them as head of the scapula. So head has to be placed laterally. So you have to keep it laterally. Once you have this decided, this particular side of the bone belongs to the right side, you have to have this right side holding, right? So once you have this, you can hold it like gun holding fashion, just like the way we hold a gun. And this particular bone, which is lateral side, directed laterally, it's a little bit forward and upwards. So this should be facing up, not like this. So this head should be faced laterally, little bit tilted forward and upish. So this is the anatomical position. This is how it is placed. So if you are not holding it upwards, you are holding it like straight, then not going to harm. But right side and left side need to be identified. Above and below need to be identified. Anterior and posterior had to be identified. So this, once you identify this particular process, your exam can begin. If you fail to identify to reach this part, your exam won't be going on. So for this, you have to identify this bone first. Name of the bone, scapula. Then you have to identify which side this particular bones, right side and left side, and you have to identify it in normal anatomical position. So normal anatomical position is like that. So this particular head is facing laterally, the spine is facing posteriorly, the inferior angle directed down or bottom side. So this head or lateral angle is directed little bit upwards, laterally and forwards like this, and gun holding fashion on the side. If it was left side, you can have it on the left side. Clear? Now, then you have to talk about the parts of the bone, then we go for muscular attachments which are salient or important. This is a flat bone. So, this had got few features. So, this part we call them as projected part, we call them as head of the scapula. Head also known as lateral angle. This is a triangular bone. So, this has got this part we call them as head. Then following the neck head we have narrow constrictions here. So, this part we call them as neck. So, head and then neck, this part. Surrounding the head we have this area of the bone, we call them as neck of the bone, right. Then we have this part, we call them as, we are holding it, we call them as body. So, 3 parts, head, neck, body. Head is also known as lateral angle. Then after head we have a narrow part, we call them as neck. Then we have flat triangular part, we call them as body. Clear? So, this particular body has got 2 surfaces, anterior, posterior. We call them as ventral, dorsal. Dorsal, back side. Back can be easily identified by presence of the bony projections. We call them as process. So, this is posterior side, we identified. Back side have got this side, anterior side. This is known as ventral side. This is dorsal side, back side. Clear? Now, this particular body have got 2 surfaces, anterior, posterior. Now, it has got 3 borders. One border above, we call them as above border, superior. One border this side, we call them as to the head side, we call them as, which side it is? Lateral side. So, opposite to lateral it would be medial. So, if you have the vertebra, so this particular scapula is, if this one assume is the vertebra, so this side is lateral side facing towards or continuous with the head, head over here. This side which is facing the vertebra, which is medial border, also known as vertebral border. This one superior, so superior border. So, 2 surface and 3 borders. Clear? Anterior surface, posterior surface. 3 borders above, lateral, medial. Clear? Now, it has got 3 angles. One angle, this one, laterally. We call them as lateral angle, also known as head. This one is bottom arm. This angle, inferior angle. Below, this one is superior angle. So, opposite to the lateral, we call them as this angle as superior angle, inferior angle, and this one is lateral angle, also known as head. So, 3 angles, 3 borders, 2 surfaces. So, what are they? What are the parts? How many parts are there? 3. What are they? Head. Head is also known as lateral angle. Then we have neck. Then we have body. Body have got how many surfaces? Posterior can be identified by process. Anteriorly, no process. How many borders? Lateral border continues with the lateral angle and opposite to the medial. Medial border is facing vertebra. Angles also known as head. Then inferior angle, superior angle. Clear? Can you remember this? Now, neck can be divided into 2 parts. One is known as anatomical neck, other is known as surgical neck. Anatomical neck is just surrounding this particular head, and the surgical one by this notch. You see the notch over here? Suprascapular notch. This is on the superior border. So, this notch is known as suprascapular notch. So, this, if you just like draw a line, just like you see the green line or blue line drawn here. So, around this region we have the surgical neck, and little bit ahead of that, where this particular head attachment surface ends over there, we call them as anatomical border. So, two neck is there, anatomical neck and surgical neck, right. If you cannot show which is anatomical, which is surgical, let go, right. So, neck is there, there are two such neck is there, one is anatomical, surgical. So, every bone has got two necks. If you, not every bone, the bones which has got neck, there are two necks are there, one is anatomical neck, other is we call them as surgical neck. They have significance there, we will learn later on. Okay. Now, coming to this particular process, this part we haven't discussed. Now, if you look close, there are two process or projections are there, one is big one and one is small one. So, this big one we call them as spine, this big one we call them as spine or spinous process, the spine or spinous process. Spinous process, if you see that becoming flat here, where I am holding here. So, spine which is kind of projected on the back of this particular bone which I am holding, this is spine. Now, this spine little bit going anteriorly becomes flat. So, this part we call them as Acromian process. So, together we call them as Spino-acromial process. We call them as, that means spinous process plus Acromian process. So, this thing is a whole thing, continuous, a part which is placed here, which is anchored here, which is anchored on the bone where I am holding. This part we call them as spinous process, which is attached on the bone, and little bit part of this is flying, right, it is on air, it is not attached. So, this part which is broad, just like snake head, right, this part looks like snake head. So, this snake head part we call them as Acromian process, we call them as and together we call them as Spino-acromial process. So, if you just like ask to show which is spinous process and which is Acromian, Acromian is the anterior expanded part, and where this particular bone is attached on this particular body, we call them as spinous process. So, you are clear with the spinous process and acromial process or not? Clear? So, spine is attached on the bone, acromian is projected, floating, just like the head which is projected like. Clear? And it is broad, spreaded compared to the spine. Spine is looking like a piece of bone, and then it becomes, somebody hammered it and made it like flat and wide. This is Spino-acromial process. There another process coming from top of this particular head over here. You see that this part we call them as head of scapula. So, from this head of the scapula, we have on superior part of it, we have a projections there. We call them as Coracoid process. We call them as Coracoid process. Coracoid process. This Coracoid process flying already. So, Coracoid process, if you see that, it has two parts. One is which I am holding is vertical, and then it is horizontal. It has an angle between. So, this part which is anchored I am holding. So, straight part we call them vertical part, and then it make a bend, it changes the course, becomes anterior. So, this one we call them as Coracoid process base, and this one is known as tip or anteriorly directed. This part, it has a bend in between. So, it has looks like a present like right angle like this, vertical part, then a bend, and then it is directed anteriorly. So, this particular Coracoid process is a kind of projected part which is present on this upper part of the head of scapula. This was actually a different bone, somewhere it was coming and anchored here when this particular bone was going. We talked about ossification in the previous class, like different kind of ossifications was there. There are number of bones are coming there. So, this particular bone was a separate bone, this Coracoid process coming from somewhere, it fitted in here, and then it remained with this particular bone. That is why it is kept taking a different kind of shape like this, right? This kind of thing which is growing in a different piece of bone, we call them as epiphysis, and this kind of epiphysis we call them as aberrant epiphysis. Aberrant epiphysis is a kind of like a extra or supernumerary ossification point for the bone, alright. So, this was altogether a different bone, this small piece. So, coming to these particular parts of the bone, what are the three broad parts are there of this particular bone? Head, neck, body. Head known as lateral angle, body, surface, can be identified by posteriorly bony attachments, anteriorly no such. Angles, borders, processes, Spino-acromial process, Coracoid process. Other than this, neck have got two necks, anatomical, surgical. Surgical is little away, anatomical neck is immediately after that. So, first constriction is anatomical neck, then surgical neck. Okay, okay, good, good. Okay, so let's talk about some areas on this particular region. Now, as this particular spine is their back side, so this particular posterior side is divided into two parts, above the spine, below the spine. So, we call these depressions above the spine and below the spine as fossa. We call them as fossa, F-O-S-S-A. This above depression we call them as supra, this one infra. So, above the spine, supra spine fossa, below the spine, infra spine fossa. So, supraspinous, infraspinous fossa. Two fossa on the which side? Front or back? Posterior side, also known as dorsal. Ventral is this side, ventral is anterior, dorsal is back side. Dorsal side have got spine. Spine is dividing the area into two parts, supraspine, above spine, below spine. If we have a muscle present here, we call them as supraspinatus muscle. Below here, infraspinatus muscle present in here. Anteriorly, we do not have any split, continuous fossa. So, we call them as this fossa as subscapular, scapula or under scapula. So, if you say something below, that means we call them as sub, which is under. So, the fossa is under the scapula, we call them as subscapular fossa. So, this fossa anteriorly, which is placed all the way here, we call them as subscapular fossa. It is not divided. This side divided, above and below. This side, this entire thing we call them as below scapula fossa. Below means sub. Scapula, so under the scapula, subscapular fossa. If we have any muscle attached here, we call them as subscapularis. Okay. Supraspinatus on which fossa? Above fossa. Which then supraspinous fossa, below the spine, infraspinatus in the infraspine fossa. Clear? Below the scapula, subscapular fossa, subscapularis. Three fossa, three muscle attached to it. Clear? This fossa, muscle, this fossa, supraspine, supraspinatus or supraspinous muscle, infraspinous muscle or infraspinatus. Okay. So, supraspinatus, infraspinatus, subscapularis on the fossas. 3 fossas, C space. Clear? Good. Now, we take this border. So, this medial border and lateral border have got important muscle attached to it. So, medial border, that means known as vertebral border, lateral border which is this side along with the head. Now, so this posterior side, that means the dorsal side, have got muscle attachment here also, right. So, on these margins we have muscles attached. So, these muscles attached, we talk about this particular form vertebral side first, then we talk the lateral side first. That means medial first and then we talk about the lateral muscles. So, on medial side we have muscle attached on this side, on the supraspinous fossa medial border here, and 2 muscles attached on the infraspinous border like this medial border. So, 1, 2, 3. So, 1 muscle is attached here, 1, 2, 3. 3 muscles attached here, 1, 2, 3, above, middle, below. Above one is going from the scapula to these vertebral spines. So, it is elevating the spine, elevating the scapula. It is elevating the scapula. When you are moving the arm, it is moving the arm up, moving the scapula up. We call them as levator scapulae. That means it's elevating scapulae. That means elevator, levator scapulae. We call them as levator scapulae. Where? In the upper part. Which border? Medial border. So, we identify the border. I place my finger here. We call them as levator scapulae, elevating scapula. Then we have 2 muscles here, one above, one below. We call them as rhomboid, rhomboid minor and rhomboid major. It's looking like rhomboid, that's why you known as rhomboid minor, rhomboid major. Lower one is major, minor one, a smaller one above. The small one is lying above and the larger one lying below. Clear? So, 3 muscles on this border, medial border, also known as vertebral border. One is above, levator scapulae. So, moves the scapulae up. Then we have minor, then we have major. Rhomboid minor, rhomboid major. They look like rhomboid in shape, that's why they are known as rhomboid. If you see that right side, left side, they look a rhomboid shape. Okay? Rhomboid minor, minor means small, major means large. So, larger one is lying at the lower part of the vertebral border and the smaller one is lying on the middle part or central part of it. Likewise, this side we have lateral border also have muscles, but here we have 2 of them to consider. Here we have 2 of them, they are also known as minor and major. So, this side we call them as teres or teres, T-E-R-E-S, starting with T, T-E-R-E-S. So, above minor, below major. So, teres minor, teres major. Here we have 2, 1 and 2. So, teres minor above, small one, and teres major below. Here we have rhomboid. So, same sequel, above one minor, lower one major. So, on the medial side we call them as rhomboid, lateral side it is known as teres. Teres minor, major, rhomboid minor, major. And on the side we have number 1, levator scapulae, which is present on the vertebral border. Here, now in this inferior angle, we have another muscle which is coming from all the way down. We call them as lat, also known as Latissimus dorsi. Latissimus, L-A-T-T-I-S-S-I-M-U-M-S, Latissimus D-O-S-I. It's a large flat muscle. We'll see that when you go to do dissections. It is known as Latissimus dorsi. So this Latissimus dorsi comes from this hip bone. All the way it comes like this and ends somewhere here in the humerus bone. So it's a flat bone arching like this. So this muscle which I am holding is Latissimus dorsi. Alright. It is a muscle which is known as rowing muscle or climbing muscle. If you climb it, clinch something and pull your body up. So we call them as chin up exercise. So that particular Latissimus muscle becomes visible. So it's present on the side. Lateral side, it is present making a mass. We call them as Latissimus, and it is present on the dorsal side. That means posterior side. So Latissimus dorsi, laterally present mass on the dorsal side of the body. Latissimus dorsi. It's a flat, broad muscle. This is the broadest and flattest muscle of our body. Lat. In short, we call them as L-A-T, lat. It is present, it has tiny attachments at the inferior angle. Only in the inferior angle, it has a tiny attachments. Clear? So, medial border, lateral border and inferior one, we have this. Now, apart from this, we have a muscle, we call them as serratus anterior. That one we have to remember. Serratus anterior muscle, that's what you are saying. The Latissimus dorsi. You see that? It's coming all the way from the hip bone, fanning out and attaching, just making a small attachments here. You see that this is scapula, an inferior point of the scapula, it is making an attachment, just it is lying at. Then it is going to this arm bone, going to attached over here, this bone, right? So this flat bone, right side, left side, we call them as Latissimus dorsi. This is a flat lat muscle. This is very important muscle we have to learn about, Latissimus dorsi. And then we are going to talk about one muscle, we call them as pushing or punching muscle. Now you see this is a rib cage. You can see that rib cage. There is a muscle which takes like fingers. We call them as digit. In anatomy, we call these fingers as digits. So this particular ribs, lower 8 ribs, from there is a muscle, flesh of muscle comes over here and goes to the scapula and attaches to the anterior border of the medial end of the scapula. That means this particular muscles come. So this is the rib cage that we have, right? From the rib cage, that's like fingers I am placing, this particular muscles are attached on the sides and they are moving across going back, and we have the scapula over here. Now where they are going to attach, we have to attach with this scapula at the medial border. This is the medial border of the scapula. This is the lateral border of scapula. Here will be the head. So this is how this particular scapula will be placed. So these particular muscles are coming from the ribs like this, and they are going to attach on here. So they cross this muscle over here. We have this fossa. What fossa we have? So they run along with the subscapularis fossa deep to it and then attached on the medial border of anterior part of the medial border of this bone. So this particular one is a vertebral border. So we call them as medial border as well. So medial border have got this one is anterior side, this is posterior side. Posterior side 3 muscles are attached. 1, 2, 3. Levator, scapulae, rhomboid minor, major. Now this side, inner side, we cannot see it. So this side, if you flip it, this is the anterior border or anterior border of the vertebral border, anterior surface of the vertebral border. So this muscle attaches on here like sleeves. Thank you. So this muscle comes over here and attached on the anterior border of the scapula along this particular length. So this muscle is known as serratus anterior. Serratus anterior. They are attaching on which border? Medial border, but anterior aspect of the medial border. Clear? So this is which border? Medial border. This is posterior aspect and this is medial border, same medial border, anterior aspect. So this muscle is attaching on here, but this is coming across and they are like coming like fingers. So this particular muscle we call them as serratus anterior. They come like sleeves or digits like fingers. They are coming and crossing over subscapularis and attaching on the medial border. So they are known as serratus anterior muscles. So this particular serratus anterior is very important muscle, and lat, which is another very important muscle, latissimus dorsi. Yes, that serratus anterior muscle is responsible push and punch. They help to push or give a punch. They move this particular pushing and punching muscle or pushing punching action. So this muscle is known as pushing punching muscles. The lat is known as climber's muscle. They help in climbing. So they are known as climber's muscle or rowing muscle. They help in rowing, boat rowing. So they are known as because of their actions. So coming back to the muscle. Supraspine, infraspine, subscapularis, levator, scapula, levator, scapula. Okay. Serratus anterior. Okay, good. Two more, then we are done. Two more muscle attached, then we are done. We take this one. We call them as spine with acromion, spino-acromial process. Upper end, lower end. It has got several parts, base, apex. I am not going to make these things complicated. So this is spine or with the acromial process, spino-acromial process. So this spino-acromial process have got above border and below border. There are two borders are there, above, below. Can it be? So this one is above, this one is below. Clear or not? So above border and below border. So above we have a muscle attached, we call them a strap muscle, trapezius, T-R-A-P, trap. This particular trap is helping to shrug the shoulder. You will shrugging it, I don't know. If I am going to come back next day, I don't know. So shrugging muscle. So this is trap, trapezius. And below we have a muscle, we call them as deltoid. This muscle, we call them as deltoid. Deltoid, trapezius. Trapezius, deltoid. Above is trap, below is del. Deltoid, trapezius. Trapezius is coming from above. Again, we have a volunteer, right? So trapezius is coming like this above, and this is coming from below as well. So this trapezius looks like this. So above it is coming here, trapezius, and deltoid is coming like this. So deltoid, trapezius. Above and below the spines, superior spine, inferior spine, trapezius, deltoid. Okay. So this is all about body and spinous process, acromial process. We are done. Then we are left with this small thing. Again, Coracoid process, two things. One is tip, this part, this one, anteriorly directed tip, right? This tip is having the short head of biceps brachii and coracobrachialis. There are the three muscles are there. We call them as BBC. We call them as BBC. Brachialis, biceps brachii, coracobrachialis. BBC. Brachialis, biceps brachii, coracobrachialis. So B, biceps or brachialis, then another B, biceps brachii, and C, coracobrachialis. B, B, C, they are present here, all of them. So biceps are known as biceps, that means ceps means head. Cep means biceps spelling is B-I-C-P-S. Now you take this bi out, we call them as ceps. Ceps means head. Now bi means two. So two heads are there. One we call them as long, other is short. That means it has a long tendon, it has a short tendon. That's why they are known as biceps. Now if they have three heads, we call them a triceps. Long head, short head, like that. So we have lateral head, medial head, and long head. Three heads are there in triceps. So in biceps there are two heads are there, long head and short head. So long head attaches at some different point, short head attaches on the different point. So the short head of biceps and the coracobrachialis of this BBC. So short head of biceps brachii and coracobrachialis. So one B and C is attached tip of this coracoid process. So tip of the coracoid process gives attachment to short head of biceps brachii and long head, coracobrachialis. Okay, this is what we have to keep in mind. Other thing is there is another muscle attached, I let go. So tip of the coracoid process, short head of, so they should be uttered at the same breath. We cannot just like remember simply. So you have to remember or memorize it, short head of biceps brachii and coracobrachialis. That's it. At the tip of the coracoid process. That's it. If you remember that way, it will stick to your brain, or else you will be missing it. Alright. Now coming to the other head of biceps, that is left with long head of the biceps. So the long head of the biceps is attached above this particular head. We call this, on the head we have two bony parts. We call them as fossa or nodules. This part we call them as glenoid fossa or glenoid, this head part, which is articulation for this humerus. We call them as glenoid joint, right? So above here we have a bony part, we call them as above glenoid, supraglenoid tuberosity, and below here we have a tuberosity, we call them as infraglenoid tuberosity. There are two bony points are there, right? So there are two bony points are there above this head and below this head. Above this head we call them as supraglenoid, because this is a glenoid cavity. This joint we call them as glenohumeral joint. So shoulder joint. So above the shoulder joint, below the shoulder joint, there are 2 points up there. Supraglenoid tuberosity and infraglenoid tuberosity. That means a bony bump projections. So this supraglenoid tuberosity gives attachment to the long head of biceps, and this infraglenoid tuberosity gives attachment to the long head of triceps. So we have 2 projections. One of them are known as supraglenoid tuberosity, and below one we call them as infraglenoid tuberosity. So this particular tuberosity, oh no, so assume this is a shape of the glenoid cavity of the head of humerus, scapula. So in the head of the scapula above we have bony projections, and below we have another bony projections. This head holds a cavity in it when it is forming a joint, the shoulder joint. So we call them as glenoid cavity. So, this bone which is bumped here, we call them as above glenoid. Supraspinatus, just like we call them as supraglenoid tuberosity or bony projections, and infraglenoid tuberosity or infraglenoid bony bump. So, here we have above bi and below we have tri. All are long head of biceps and long head of triceps. So, they are taking attachment to these particular bones. Clear? So, so many muscle attachments and the bony parts you have learned. So, above this spine, above spine muscle, supraspinatus, infraspinatus, subscapularis. Then levator scapulae, rhomboid minor, major, lat, teres minor, teres major. Flip it to this side, subscapularis, medial border, anteriorly serratus, anterior muscle. Spine above, below. Above is trapezius, trap, below del. This one coracoid process. Tip of the coracoid process, we have short head of biceps brachii and coracobrachialis, and coracobrachialis and all these things we call them as BBC, biceps brachialis, coracobrachialis. Now, this particular biceps have got two heads. One head is attached on this supraglenoid, we call them as long head of biceps. The short head of biceps is on tip of the coracoid process. Together they are coming, and the infraglenoid gives attachment to the long head of triceps. Triceps have got three heads: lateral head, medial head, long head. Biceps have got two of them. One is long, one is short. Long means they are going farther away. Short is coming below. So, this particular end which is looking like that, that is why we call them as long head of the biceps, short head of the biceps. This particular bone articulates with two other bones. One is humerus, making the shoulder joint. We call them as glenoid humerus, glenohumeral joint, also known as part of shoulder joint. Glenohumeral joint, which is the shoulder joint. Shoulder joint have got few components. One component of the shoulder joint is this part, glenohumeral joint, and this particular bone we call them as acromial bone. So, on the acromial process or acromial bone, we have this particular clavicle. So, this particular anterior undersurface, we have a notch. We call them as clavicular notch or clavicular facet. So, clavicular have got two heads. One is medial head, other is lateral head. So, lateral head is flat. This flat head attaches to this particular acromial process anteriorly or inferiorly, making this particular joint as claviculo-acromial joint or acromio-clavicular joint. Clear? So, two joints are participated by this shoulder joint and this collarbone joint. There are a number of ligaments are there which is holding this. We will learn that. Coracoclavicular ligament. Another is costoclavicular ligament. Costoclavicular ligament is related to the clavicle with this costo, ribs, and intercostal. That means costi means ribs, that is related to the ribs, not related to the scapula. Others, acromioclavicular ligament, acromion to the clavicle, acromioclavicular ligament. Here we have the suprascapular ligament, scapular above, suprascapular ligament. So, which is joining this particular above. So, this notch we call them as suprascapular notch, this tiny notch. So, passes here is suprascapular nerve. So, it will complicate, we will forget all the major things which we learned. So, basic thing is about this particular bone. So, now coming back to the same thing, anatomical position, above superior one, below superior border, this part head, lateral angle. The cavity within the head we call them as glenoid cavity, which is for the joint formation. Above this particular glenoid we have the bony part, supraglenoid tuberosity, infraglenoid tuberosity, supraspinous fossa, infraspinous fossa. This one Coracoid process. This one spine with acromial process. So if I am holding here, we should be telling it spine or spinous process. If I am holding it together, acromion, together spino-acromial process. Muscle attached, subscapularis, infraspinatus, supraspinatus, levator scapulae, rhomboid minor, major, teres minor, major, lac, trap, del, triceps, long head of triceps, long head of biceps, with short head of biceps with coracobrachialis, CB, coracobrachialis with short head of biceps. Long head of biceps is attached here, short head is attached here. So there are two muscles head which are attached here, and below here we have long head of triceps. And then on this vertebral border, anteriorly vertebral border has got serratus anterior, pushing punching muscle. Clear? Two joints, glenohumeral or shoulder joint with clavicle, acromioclavicular joint. Okay.